Many people don't know about the Daigle report, and that's spelled D-E-A-G-E-L. Daigle.com was a website that one of the big areas was a focus on population changes to come. And the Daigle report 2022-2023 made the projection of a 78% decline in population of the UK by 2025, declines in population of Israel, Australia, US, Canada, essentially all of the Western European and North American. The Daigle.com website had population declines anywhere from 35 to 78% in those countries. By 2025, we are seeing those declines playing out.
Welcome to the Deconstructing Conventional podcast. This interview is brought to you by Healing United, a private membership association committed to helping you reclaim sovereignty over your health, life, and future. You could say our tagline is question everything and rebuild intentionally. In the audio format of the show, there's additional commentary before each episode, and there are also over a dozen audio-only episodes. You can find the show anywhere you listen to podcasts, including the Healing United PMA app. Look for it in the App Store, and if you want to learn more about the work we do, and especially how we help people heal when the doctors have no answers, visit us online at healingunited.today. Now, on with the show. All right. Hello, everyone. Welcome back to the show. It is my honor to re-welcome Dr. Lee Vliet to continue our conversation. I guess I'd say we could say we're excited to have it, but we're more just, we accept the responsibility to have this conversation about some of the ugly things in the history of humanity and to do our best to just bring them into the sunlight and talk about some of what we have lived through. So we're part 2 of our conversation on eugenics and just replaying the history so we can see more clearly an accurate map of reality and work to build our lives around what's real, not what's the official reality. And so, Dr. Vliet, welcome back to the show. It's great to have you.
Thank you so much, Christian. It's a pleasure to be back with you.
Fantastic. Well, let's dive in. So we left the listener right around the end of the 1990s last time in this timeline of the eugenics history. And so jump in for us and kind of just start from the 2000s forward. And this will get a little more personal because we've all mostly lived through this era. And so I guess if there's good news here, it's that no matter which political party you may have been a part of or who you voted for, both sides of this aisle have let us down and have participated in this agenda. So take heart that we are just going to talk about what has happened and do our best to give you some eyes to see things that may have been in the shadows before. So take it away, Dr. Vliet.
Well, thank you, Christian. And I think the important thing is that while people may say, well, why go back over all of the bad things that have happened? I see it more as connecting the dots of how these pieces of the puzzle what we've been living through in the last 4 years since COVID was unleashed on the world, how the pieces of the puzzle were put in place long before 2020, and how that fit with the 100-year plan of depopulation, which has been promoted by the eugenics movement, by the Club of Rome, the Committee of 300, Cairo Population Accords, and a host of the global predators who choose to subjugate humanity and kill off humanity to serve their own purposes. And in order to stand against it and to fight back to survive, we need to understand what they've put in place and how we can begin to expose it and rally more people to stand against it. And so I think that's why the Lord has us in this place at this time, with the knowledge that you and I each have taken time and effort to uncover so that we can share it with others and be the watchman on the wall, which God asked us to do.
Right. Yeah. Well, that's why we're here. So start giving the listener some of the history they may not know. We'll go back to 2000, 2001 and take it from there.
Well, it was in the time frame of 2001 to 2002 that the SARS-CoV-1 respiratory virus outbreak occurred. And this was also a lab leak from Wuhan, China, Institute of Virology. And it was more limited in spread, and it did not reach the level of a global pandemic. But what is significant about the SARS-CoV-1 viral illness is that later in 2020, SARS-CoV-2, or COVID-19, as it was also called, that viral illness, when they did the sequencing of the actual genome of the viruses, SARS-CoV-1 and SARS-CoV-2 shared about 80% of the same genome. And the reason that I think medically that is significant is that the NIH, under Anthony Fauci's agent, Anthony Fauci was at NIAID under the NIH at the time of the SARS-CoV-1 outbreak. He also is the nefarious player that handled the AIDS epidemic and lied to the public on that as well. That was in the 80s. And my point about this is that research that they did at NIH in the early 2000s showed unequivocally that chloroquine and its sister drug hydroxychloroquine had potent antiviral activity against the SARS-CoV-1 virus. They did the research around 2002 to 2003. The paper was published in 2005 in the Journal of Virology, which is the publication of Fauci's own agency. So there's no way in 2020 that Anthony Fauci did not know that hydroxychloroquine and chloroquine were potent antivirals against SARS-CoV-1 and SARS-CoV-2 that shared 80% of the same genetic makeup. So we had a treatment, and I found that article from 2005 in about 5 minutes on the internet in March of 2020. So I knew then that we had drugs that could work against this new COVID illness that we were being told was a novel virus. It wasn't novel, and it was man-made in gain-of-function studies. And what was interesting about hydroxychloroquine and chloroquine is that they blocked the first two steps in the establishment of a viral illness. They blocked the virus entry into the cells, and they blocked the second step, which is viruses use our cellular machinery, or animals' cellular machinery, to replicate and then spread throughout the body of the host. So hydroxychloroquine and chloroquine blocked viral entry into the cells, and they blocked replication. So it's very clear, and it worked. I treated all of my patients with COVID very quickly, 3 to 5 days of symptoms. We got on treatment right away, combination approaches that Dr. Zelenko and myself and many other doctors were using at the time, and put all the combination medicines and nutraceuticals together. And everyone I treated for COVID recovered, no one went in the hospital, and no one died. So we didn't need the vaccine. Mm-hmm. The COVID injection was designed to be toxic to reproduction and the cardiovascular and nervous systems in particular. And it was, as Dr. Mike Yeadon has said so often, toxic by design.
Yeah, that's the hard part to swallow, is that there was malicious intent, and it was, you're rewinding, like, we already saw this movie back in 2001 and 2002, and they didn't hit the scale they wanted. So they basically pulled it off again, and this time with more breadth of, I guess, media hype to go with it and on it testing and everything else. So give us the in between these kind of things, or I guess I don't want to redirect you. Finish your point on the SARS 1 and 2.
Well, I think the point is that this was a dry run.
Yeah. You're still muted, by the way.
I was saying you may have to mark this to edit out.
Yeah, no, the magic of editing will be placed right here.
I have an allergic dry cough, and every now and then I get that spasm, and it won't stop. So I apologize.
No worries.
So, okay. I think the point is that the SARS-CoV-1 outbreak really was like a dry run, and they were already working on the mRNA vaccine technology then. They were working on that same technology for the AIDS virus, and they never were able to accomplish that. So this is the mRNA technology has been in development for at least 25 years, perhaps a little longer. And the lipid nanoparticle component of the vaccine, I want to emphasize this right here, and we'll probably pick it up again later, that was known to be damaging to ovaries and testicles in all animal species studied 15 years ago.
Mm-hmm.
So when they were working on this technology and they needed to coat the mRNA with lipid nanoparticle technology to drive it across the cell membrane to get into the blood-brain barrier and into the brain, to cross the placental barrier, to get the mRNA inside our cells. That was the technology they used. And at least 15 years ago, they knew that it damaged reproduction in males and females of all species studied. So let that sink in. When
Right.
you say it's hard to wrap your mind around the intentionality of it, of the damage,
Mm-hmm.
you have to look at the fact that they went ahead using the technology they already knew damaged reproduction. So it's clear evidence that damage to reproduction was known, planned, and delivered in the COVID shot. And if you look at the COVID illness that was so easily treatable quickly in the outpatient setting, I realize people died from COVID illness, but they died because they were told to go home, and if they got worse, come back and treat when it was already past the viral illness and into catastrophic inflammatory cascade and acute respiratory distress syndrome. And at that point, treatment is very difficult. But all the early treatment approaches for that illness worked very well. The reason they were not allowed to be used, doctors were prevented from using them, is that the agenda was to push people, use COVID as the fear to drive people into the box canyon of no outlet except the COVID shots.
Mm-hmm.
The COVID shots were the end game. COVID was what was used to scare people to get the shot.
Yeah. There's no other thing we could possibly do.
Understand.
The COVID shot's the only answer to everything else that might impact health. It's like we do nothing or we do the shot, and there's no other thing on the table. And it's such a weird thing to rewind and look at and be like, yeah, why was it that there were no other things we were allowed to do?
Well, and there were other things that were discussed in the media, because I was one of the people talking about hydroxychloroquine, for example. But we were suppressed, we were
Yeah.
censored,
Yeah.
suppressed. Doctors were persecuted. Doctors lost jobs. Doctors lost medical licenses.
Yeah.
So it was clearly an orchestrated censorship designed to prevent the larger public from knowing there were treatments available. Now, if you fast forward from following the SARS-CoV-1 outbreak in 2002, in 2005, the World Health Regulatory Agreement document pushed by the World Health Organization was signed by 196 countries who gave up their sovereignty and ceded authority to the World Health Organization to be able to dictate response to any designated, and this is the critical term, quote, public health emergency of international concern, end quote, or PHEIC. And some have pointed out that means fake if you pronounce it. But a public health emergency of international concern was the buzzword that triggered the legal framework of the 2005 International Health Regulatory Agreement to be implemented by WHO, allowing the World Health Organization to have control of medical delivery, public health measures, media narratives, medications used, and that has major implications for population control. Because by suppressing treatments that work, later ivermectin was clearly one of those, the World Health Organization was participating in the depopulation, the long-term depopulation agenda. And then fast forward, so that's 196 nations agreeing to let the World Health Organization dictate their response in a public health emergency, rather than local public health officials in each country assessing the situation on the ground in their country and making decisions for their country based on their needs, which is the way it's had always been.
Yeah.
Then in 2009, when President Obama had just been inaugurated, Ezekiel Emanuel wrote a new paper on the complete live system, and he became the White House senior health policy czar under Obama and the architect of Obamacare, with billions of dollars cut from care for the elderly with Medicare and older Americans, and it provided for government-funded contraception, government-funded abortion, rationing of care for the elderly, and shifting money into treating younger people between roughly ages 15 to 40. That was all part of the depopulation agenda as well. If you provide free contraception across the board, paid for by the government, free abortion paid for by the government, you're preventing pregnancy, you're ending pregnancy, so you're decreasing the population at that end. You're decreasing the population in the older age group by rationing care so they die sooner. And then that all goes to the long-range eugenics agenda. And then also in 2009, which most people don't realize, is that was when the Troubled Assets Relief legislation, or TARP, was passed as a financial answer to the economic crash of 2008, in the fall of 2008. And the TARP legislation, unknown to the broader public, because that was another one of those massive bills that nobody read.
Right.
And how it was ready within a month of Obama's inauguration is another questionable point to consider.
Right.
This massive legislation was obviously prepared ahead, but what they hid in that was 2 tracks of control of healthcare and rationing medical services. The health information technology legislation that mandated the electronic medical records that allowed tracking of everything about you, including whether or not you were a gun owner. So they actually began tracking gun ownership in medical databases with directions to pediatricians and primary care doctors to ask children under the guise of safety, do your parents have a gun in the home?
Wow.
So they were already starting to track gun ownership through the medical records. And I spoke on that at a major event in Idaho, about 7,000 people in the audience that day. And I started telling all of these people in Idaho they're going to be tracking your guns in the medical database. And the crowd roared.
I bet they did. That's
outrage.
So invasive. Jeez.
Well, yes. And I said, you watch, it's coming. And sure enough, it has. So the healthcare information, electronic medical records, they track everything. Secondly, in the TARP, they also set up the Independent Payment Advisory Board for rationing of medical care. Now, later, that was what Sarah Palin referred to as the death panels, and everybody mocked her and said, oh, no, it's not in Obamacare. Well, it wasn't in Obamacare. That was passed in 2010. They had already passed this in 2009. So it was all in place.
Wow.
In case Obamacare didn't get passed.
And that's the Independent Patient Advisory Board is where they were able to restrict age?
Yes, the Independent Payment Advisory Board was a panel of experts set up to decide what Medicare would pay for, Medicare, Medicaid would pay for, and what they would not, which in effect rationed care. For example, if you have a certain body mass index, they wouldn't pay for a knee replacement because you're too fat. So they could make decisions like, if you're too fat or too old or you have diabetes, then we're not going to pay for these services. So they were ratcheting down the services that would be allowed. So like in the UK, they wouldn't pay, the NHS wouldn't pay for Lucentis for macular degeneration until you'd already lost the vision in one eye. Whereas in the US, people could have it preventively to prevent loss of sight in both eyes.
Jeez.
So it's that was the group that was to make those decisions. Now, and that was already in place. That's what I wanted people to understand. And it was around 2009 that pharma research. So see, a lot of these things were coming together right as Obama took office. They knew they were going to go for government control of healthcare. And so all of these pieces of the puzzle were being put into place to facilitate that. And it was around 2009 that the pharma research journals published papers showing that the lipid nanoparticle technology for the mRNA shots damaged the ovaries and testicles in every animal species. So they already knew it caused reproductive damage as early as 2009.
Yeah. No, there's
maybe earlier.
Yeah, there's such patient gradualism that these people practice of just laying, like your point, laying train tracks. We're going to need this in 10 years. So let's get this in place. And we got to figure out how to market it and which buzzwords the people are going to swallow. And it's just a patient attempt to, their agenda is set. And it's just digging through the rubble of their, or the forensic audit, if you will, of what they have been doing. You unearth stuff, you're like, ugh, you can actually see intent, not just bad judgment.
Oh, exactly. No, there's no question. This was intentional design of curtailing life.
Well, it's also the hubris to say, you know what, we need to have some people in Washington decide how long you should live and which serve, as if they're somehow qualified to be and taking in all the information relative to your situation, and they've thought of everything. It doesn't even pass the smell test that we would have a system like that. Yet that's precisely what they were building for a different purpose.
Exactly.
Yeah.
And then 2010, Obamacare was passed, which put the government, the federal government, in control of every decision made in healthcare. What insurance you could buy, what the insurance companies could charge for it, what they could cover, what they were required to cover. There was no longer risk management decided by the insurance carriers. It was decided by the federal government as to what the standards would be. And massive cuts to Medicare services. So Obamacare has been one of the biggest intrusions into the physician-patient relationship and the ability of doctors to decide independently for a patient what's in that patient's best interest. And that was part of Ezekiel Emanuel's philosophy in the complete life system. We need to do away with the oath of Hippocrates, focus on the individual, and we need to focus on the collective good. That's a Marxist concept.
Right. Well, and what we decided is a complete life. That, like, we'll define that for you, and then when you fall outside of our definition, then your access to services are cut off. Like, what a gross way to approach anything. But carry on.
Exactly. So then we come to the years of 2011 to 2015, and that was the surge of the border crisis, the first time under Obama.
Mm-hmm.
And when the Border Patrol, and I was working directly with some of the Border Patrol and counterterrorism agents here in Arizona at the time, and they were updating me on what was coming across the border, and I was giving talks with them about the implications medically of the diseases coming across the border. And so from 2011 through 2015, we had massive numbers of illegal aliens from countries around the world, particularly Central America, Pakistan, China, Middle East, North Africa, coming across the border, the southern border. Tucson sector was particularly hard hit during that time. Texas also. California's border wall was more secure, so there was less of a problem there. But that's when a lot of the mysterious respiratory illnesses began cropping up in cities around the US, and people didn't understand where it was coming from. That particularly in 2014, the mysterious respiratory illnesses that popped up in American cities killing young children. And that was later traced to a viral illness brought in by Central American illegals that the DHS planes, Department of Homeland Security contracted planes, were flying all over the US. We tracked some of those. They would pay for charter flights from Tucson International Airport between midnight and 3 a.m. nonstop from Tucson to cities we never had nonstop service to. And these charter flights, then when we started exposing it in some of our medical and other activist groups, they stopped listing the flights on Flight Tracker.
Yep, he's caught them with their hand in the cookie jar, and they have to change tactics because they've been brought into the sunlight, even between midnight and 3 a.m. Well done.
So that was a lot of the diseases coming across the border then. Federal funds were actually put in the budget during that era with the Obama administration to pay for these illegals coming across the border. And one of our whistleblowers in Arizona went back through the federal budget leading up to that and found in the federal budget the funds that were allocated in 2011 for the border surge that took place in 2014.
So what's your sense? I don't know if this is in your purview or not, but how does the eugenics angle tie into the human trafficking and organ harvesting and those sorts of things that are obviously are still here going on? But what is that correlated, or are they just
Yes, I think it is.
okay?
First of all, immigration done legally always has medical screening, regardless of what country. I mean, when we were legal immigrants to Chile to get a visa to live and work, a residency visa in Chile,
Hmm.
Panama, and a couple of other places around the same time, we had to go through medical screening. Legal immigrants to America have to go through medical screening. The illegals do not have any screening, and they come from countries that don't have vaccination programs for the kinds of diseases that had been eradicated in the US, smallpox and many others. Tuberculosis was nearly eradicated in the US until these border surges of illegals from countries that had a high incidence of drug resistant tuberculosis. And now that's skyrocketed in the US, and it's very expensive, very hard to treat.
Hmm.
So when you have these diseases, you have people die from those. You also are weakening people's immune system, damaging their health. So it's a combination of depopulation through death and through abortion and through infertility, preventing pregnancy, but it's also depopulation through gradual weakening of people in their health, and they die earlier than their life expectancy would otherwise be. So it all ties together, and it ties into the replacement of the people who were born in America, whether they were Native Americans or whether they were Anglo-Saxons, whether they came from other countries and legally immigrated here. People who were naturalized citizens of America or born here, if you dilute those people with people who have none of our cultural history, none of our values, then you are undermining the fabric of society, which also leads to more violence and more death from criminal action as well. So it all serves the long-range agenda of reducing the population.
Yeah, well, similar to like you're straining the municipalities, you're straining the economics, the workforce, the housing, like all of it
and
gets,
medical services.
yeah,
Sure.
yeah. And it's just it's corrosive to a society is basically the way they're
Exactly.
doing it. Yeah.
It's designed to collapse a society. It's the Cloward-Piven strategy that was taught as a Marxist strategy for overthrowing a Western constitutional republic or constitutional democracy or a Western secular civilized society. So then that was going on under Obama. Also under Obama in 2012, he issued an executive order changing the Smith-Mundt Act, which was a post-World War II law that prohibited using propaganda and lies on the American public for a political agenda. The Smith-Mundt Act had always been in effect to prevent the use of propaganda and deception against the American people.
Right.
Obama issued unilaterally an executive order in 2012 called the Smith-Mundt Modernization Act, and specifically, it wasn't modernization, it was gutting it, but it specifically allowed CIA, media, any government agency, any media outlet to use propaganda to target Americans to specifically support government narratives. That was the basis for the censorship that we've been experiencing, but we saw on steroids under the COVID era.
But what was the pretext for why that was a good idea? Did they have one, or
Well,
did they just
because
do
it
it and never?
serves, no, it serves the government agenda, which was moving towards control of the population, pushing people into only a government narrative.
So they never had to bother trying to sell this to the American people. They just did it in secret and dismissed this act so they don't have to bother with the pretense of the
Well,
First Amendment.
exactly. And
Jeez,
that
I
was
did
the
not know that.
basis for the coordination of all of the major media outlets all having the same script.
Yeah, I didn't know
And
that
it
part.
was directed by the federal authorities.
Yes, censorship was the thing that woke me up to this is way bigger than pharma. I never trusted the COVID narrative from day one, but I
Right.
didn't get how they could just censor and be like, yeah, we did that. So what? What are you going to do about it? Like it was just a bully that could continue to go on. And you find I didn't know about this act you're talking about, but my gosh, they were so thorough and methodical at getting to the point of COVID, all for the same agenda.
They have been building the pieces and locking us down, tightening the vice for
Hmm.
100 years.
Yeah, let that sink
And
in.
it's only now that people are beginning to wake up through the activism and the truth tellers that
Mhm.
have risked so much to
Right.
bring the truth to the American people and the world. And then we move into 2016. And that election was also rigged, but they did not anticipate the landslide response for Trump,
Hmm.
and they had not changed enough of the votes. And the plan was for Hillary Clinton to be president and finish the job that had started under the previous New World Order folks, particularly and the Marxist coup that Obama was putting in place. And the more draconian Hillary care would have followed from Obamacare, because Hillary's 1993 plan that I mentioned in the previous show was to eliminate all private medicine
Jeez.
and no private care and more intensive rationing of medical services, particularly for the elderly and disabled. And the election of President Trump in 2016 absolutely disrupted their plan for total socialized medicine and government control totally in
Hmm.
the US. And he did push for free market reforms and patient freedom to import lower cost medicines from other countries. He cut US funding to the World Health Organization. And his reforms were threats to this global plan to reduce the world population. That's why one of many reasons they hated him so much,
Hmm.
because he knew their plans and he was working to stop them.
Hmm. So it's
Now, it was John McCain. If the Republicans had control of the House, the Senate, and the presidency at the beginning of President Trump's term.
mhm.
And it was John McCain who cast the vote that prevented repeal of Obamacare. So it was Republican rhinos, New World Order loyalists, global predators who prevented the repeal of Obamacare. President Trump worked very hard to do that. And I did a lot of work writing editorials about his healthcare plan, which was reinstituting more free market reforms and giving people more ability to cost shop and import medicines from countries like Europe and Canada that had similar regulatory standards. There's no
Mhm.
reason we shouldn't be able to buy them from there. And he put that into place. But it was the sabotage from within the Republican Party that prevented him then, just like we see him being sabotaged by rhino Republican and name only Republicans now, who are compromised by their New World Order allegiance.
Yeah, there's so many different theories and threads about what's going on at that level, but it is you can see that the things we can look at, the things we can document, definitely point to ugly agendas. I remember I think it was 2019, somebody, I think her name was Heidi at the World Health Organization, came out and said the number one threat to public health now is vaccine hesitancy. Like, couldn't be like
Yeah.
unclean water or lack of food. Or it's like there are too many people who are kind of starting to wake up and realize these things aren't made by angels and they might have some damage. And all the stuff you talked about last time with Gates' influence in Africa and India and what was becoming known about that industry, they were starting
Right.
to sound the alarm that the dam might break here and people might start not falling for this anymore. I just read today, I think it was, that the the uptake on vaccines right now is below pre-pandemic levels. People are backing away from these things, being like, I just saw how the sausage is made and I want nothing to do with that anymore. And so
Well, I
anyway,
think that's reasonable because, for the most part, most of the things that they are pushing so many vaccines for are treatable. You don't really need them, and
mhm.
most people don't need an annual flu shot.
Right. Well, never mind what's in it. They still have mercury in those things. Like, what in the world where from what frame of reality is injecting yourself with mercury going to boost your health? Like that,
Right.
nobody's been able to answer that question. Went to the most toxic end of the periodic table, and we're going to mix this in with some antifreeze and glyphosate, and this is going to help you get healthy. Like, no, I can't even make sense of that. So anyway, thank you for
No, you're absolutely right. And now, okay, so the election of President Trump threw
uh-huh,
a major monkey wrench into their plans.
uh-huh,
But remember, I said it was the end of November 2016, I'm
uh-huh.
sorry, when we knew that Trump had upset Clinton
Huh.
and upset their plans,
Mm-hmm.
and Trump won, that Obama appointed Rick Bright to the acting director of FDA because he knew Rick Bright would follow the previous administration's agenda.
Mm.
So that was significant because Rick Bright single-handedly cost many hundreds of thousands of lives in sabotaging hydroxychloroquine. And he later, in a whistleblower interview, bragged about the fact that he did that he countermanded his commander-in-chief and the Secretary of Health and Human Services, Azar. He refused to follow their orders to make hydroxychloroquine available through the national stockpile
Yeah, man. And to
and
Trump's credit,
sabotage that.
he did promote that.
And then remember in 2017 that Fauci was in a video that circulated all over the internet after COVID was unleashed and said that the new President Trump would
Right.
face an infectious disease global pandemic. Well, how did he know? Unless he had
He was planning
inside
it.
information about
Yeah.
the plans.
Yeah.
And there were some very highly significant events then in 2019, right before the November election of 2020. So, event 2001 at Johns Hopkins with China's Minister of Health
Mm-hmm.
attending along with US public health officials.
Mm-hmm.
And they simulated a coronavirus pandemic.
Mm-hmm.
Very similar to what ultimately rolled out.
Right.
And the military games in China were also held in October 2019. The US military participated, and that's where many were likely exposed to the SARS-CoV-2 that had already been circulating in China as early as what later came out as August 2019.
Yeah.
And then in October and November 2019, military and intelligence personnel returning to the US after being exposed to SARS-CoV-2. For example, there were many military flights into the CIA facility at Camp Perry, Williamsburg, Virginia, where I lived for many years before moving to Arizona. And evacuation of embassy personnel, many of them came into the Camp Perry facility coming back from Wuhan. And what's very interesting is that the little town of Williamsburg, Virginia was hit unusually hard by COVID in the first couple of months of the COVID pandemic, which is not usual, except for it's not a big city, and it's not like New York or Washington where there are huge crowds of people and it's easier to spread a respiratory illness. Williamsburg is more spread out. It's a small town. And for that town to have been hit as hard as it was, because still have friends there, and I was there in October of 2019 and maybe even exposed myself around that time. So it was quite striking how rampant COVID spread in Williamsburg, Virginia. And it wasn't until about a year later from some of our military people that I learned that that's where the evacuees from the intelligence community and the embassy in Wuhan were brought into Camp Perry in Williamsburg in October, November 2019.
Wow.
So then we come to January 2020, and this is an election year. So what happens? Suddenly, there's a novel virus. They lied about the asymptomatic spread. They locked everything down and shut down everything that might help you stay healthy, like going out to parks for exercise, going to church. All sorts of things were shut down, but liquor stores, marijuana dispensary, and bars and strip clubs were all open.
Essential. Right.
So I'll let you draw your own conclusions from that. And then we move into the only solution is the vaccine. There's no early treatment, another lie. All the way.
Bless you.
Sorry.
That's great.
Another edit.
That's all right.
And so all through 2020, doctors like me and my colleagues who were speaking out about we have treatment, we can treat people early, all of that was being suppressed, terrorizing the public with COVID is untreatable unless you wait for the vaccine. And so pushing everyone into this experimental vaccine, lying about FDA approval. This is another example where Obama's change in the Smith-Mundt Act allowed them to lie about the fact that the COVID shots were FDA approved. They never were. They still aren't. They were all experimental. They were all developed as countermeasures, which meant they were not under regulatory oversight for clinical trials, for safety, for disclosures of ingredients.
Sheesh.
They were developed as countermeasures, and the DoD contract was for a prototype. It's all in the court records of the Brooke Jackson case against Pfizer.
Wow.
Everything I've just said.
Yeah, they just took the onerous pretense of some sort of method and testing and safety, and they just, oh, that's so inconvenient. If we want to poison the people, this is in the way. We're going to have to find a clever way to get rid of that need to pretend. And so we can just create these shots and roll them out. And you probably know way better than I do the breadth of differences by batch and the shoddy workmanship and the high death rates in some hotspots around the world. There's just so many things that don't make sense. But speak to that a little bit. Not only did they just erase the need to pretend they were doing real science, they then just rushed to market things they knew were going to poison us. And some of the carnage that we've seen. So give us your lived experience of walking through that.
Well, it's very clear, and I connected with Dr. Mike Yeadon early in all of this. I heard his warnings in the fall of November 2020 about the risk to pregnancy and fertility. And I knew that we had a serious problem from all that he and Professor Wolfgang Vodarg in Germany were warning about then. Then I met Dr. Yeadon in July 2021, and that was the point at which he brought out that earlier pharma research that showed the toxicity of the lipid nanoparticles to ovaries and testicles. And I knew that we had massive adverse impact coming on fertility and reproduction and pregnancy. And that was when we started, Truth for Health Foundation launched our Stop the Shot campaign August 4th, 2021, and then started working with Todd Callender after he had sued the Department of Defense to stop the mandates in the military and stop the use of force to administer the shots. I started working with him in the fall of 2021, and that was when he asked us to develop the Medical Freedom Program and legal defense grants to help the military service members and civilians, but mainly the military, because they didn't have the same freedom to leave a job that civilians do, and help defend their constitutional rights for religious exemptions, medical exemptions, and to not get to refuse an experimental shot. So that was when we began really seeing all of the damage unfolding, and the COVID shots not only causing death, sudden death, and death of elderly people as well as young people, but also the rising miscarriage rate, the decline in live births, the spontaneous abortions that were occurring, infertility problems skyrocketing, men's testicular function damage. So it was very clear that the damage from the shots were causing death and disability, but also it was fitting the design to adversely affect reproduction, which was the long-term population depopulation agenda. And many people don't know about the Daigle report, and that's spelled Deagel. Daigle.com was a website that one of the big areas was a focus on population changes to come. And the Daigle report, Daigle.com, in 2022, 2023, made the projection of a 78% decline in population of the UK by 2025, declines in population of Israel, Australia, US, Canada, essentially all of the Western European and North American and Western countries like Australia, New Zealand. The Daigle.com website had population declines anywhere from 35 to 78% in those countries by 2025.
Geez, so they're
and
expecting...
we are seeing that. We are seeing those declines playing out.
Maybe not at that scale, but what you're saying is there's a definite reversal of population growth. Is that fair?
Well, not only reversal, an actual increase in loss of population. The U.S. suffered the biggest infant mortality increase in 20 years in 2022. Live births are down anywhere from 15 to 20% across European countries that are heavily vaccinated.
Dang.
It's staggering. I mean, the numbers
Wow.
are truly staggering. In fact, Edward Dowd and others have projected that we may well be on track to meet the Daigle projections by 2025.
That's next year. That's not
I know, I
2050.
know,
That's what's shocking about it. That
I
I didn't
know.
realize the numbers of live births had gone down that much, but by golly, they have been effective at executing this
Oh,
plan.
oh, it's devastating. It's absolutely devastating. In fact, some of the experts that I've interviewed for our whistleblower report talk about the danger of population collapse, not excessive population.
Right, which makes the
We are below replacement
yeah.
across most of the Western countries.
Yeah, I knew that was trending down. I didn't know it was falling off a cliff like that, though.
Yes, it's falling off a cliff.
Dang, that is significant. All right, well, let's get us to
So,
present day, and we'll start giving the listener some hope. There is always light at the end of the tunnel here.
well,
So,
let's just go back to a couple of other key
okay,
points.
okay,
All cause mortality is skyrocketing in heavily vaccinated countries. And this was just 6 months ago,
okay,
data from Europe. Croatia, this is all causes of death, the
okay.
percent increase since the shots rolled out. Croatia, 14.6% increase in all causes of death. Italy, 25%. Portugal, almost 29%. Greece, 31%. Spain, 37%. Iceland, 56%.
Wow, where can people go look this up?
Well, it was quoted in our whistleblower report that aired in November 2023, and it was presented at the European Parliament by a former judge and member of the European Parliament.
Wow, I've been pretty decent about keeping up with the news, and I had not heard that. That's concerning. And if there's anything that can maybe start waking up some more people, that would be a great set of statistics to do that. Yeah, my goodness.
So tell people listening to your program to go back and look at the archive of our whistleblower reports and all of the topics and the statistics that we've been and the damage that we've been reporting on for the last 2 years.
Yeah, I think so many of us just like we have the COVID hangover. I don't want to even talk about it anymore. I just want to move on with my life and not deal with that. And if we don't understand what's happening, there's a blind spot there.
Well, and Christian, to your point about coming to today, and what do we do, and what's a hopeful message as we need to wrap up this program? First of all, my unequivocal message is the COVID shots were toxic by design, as Dr. Mike Eden has said thousands of times. And I agree. I have looked into the research extensively. I've been treating people who got the shots, who were healthy until they did, and now are having all kinds of problems. People I've had as patients for 25 years who have just, their health has fallen off a cliff since they got the shots and the boosters. So point number one, stop getting the experimental COVID shots. Don't get the avian flu shots because they're the same mRNA technology. They're the same experimental types of injections. They aren't studied. They haven't had field trials, and they have ingredients that were known to be toxic from previous years. For example, with the swine flu, there's a squalene ingredient that was toxic. That was one of the reasons that the swine flu vaccine was pulled off the market. And so you've just got to look at doing the things you can do to be healthy. Eat right, exercise, stress management, prayer and meditation, nutraceuticals, vitamins, and do your best to take care of the health of your body. And you don't need all of these experimental injections. We have the vaccine injury treatment guide on our website. We have the COVID early treatment guide. All of those guides, the radiation injury treatment guide, all of those treatment guides give you a roadmap to stay healthy, to repair damage, and to take the steps to improve your health and resilience. And fundamentally, we need to all look at the fact that our bodies, our mind, our spiritual connection with our Creator are God's design. And all of these pharma vaccines and many of the medications that are being pushed to treat the complications of the shots, many of them are altering the design of our body and further impairing our health, while they're making money for big pharma and while they are driving us on the road to a slow death. So I really think it's important that people need to read the information that we've worked hard to create for you, to give you a step-by-step action plan of what you can do to improve your health and resilience, and not give in to the lies and the deception that somehow there's a magic drug or a magic vaccine that's going to fix you.
Right.
Most of them just end up causing more side effects and more damage and more problems.
Yeah. Well, as a health coach who I'm jumping up and down in my seat saying yes to all of the lifestyle things you're talking about. That's the work I do every day, is helping people master the basics and get such a solid foundation of health that all these other medications and superfluous things that we add can just fall to the wayside because you don't need them anymore. You have a clear understanding of what's really going on. You can enjoy health and you can actually get back in the fight rather than living from a place of fear. And you can get on with a life that's meaningful and make a difference where you can. So thank you so much for doing the work you do. Thank you for the relentless fight, for having the courage to have this discussion. It's hard to find a doctor, one, who knows this that well, but two, who's willing to talk about it at length and just lay it out and say, look, this is ugly, folks, but we've got to face it. And once we do, we can actually do something about it. So thank you.
You have to know the plans of the enemy if you are going to put on the full armor of God and stand against them.
Right. Yes. You can't fight an enemy you can't see. This is the art of war here. And we're hoping to give you some more tools and armor and perspective, just to, when you hear narratives now, just say maybe and question things. And don't be afraid that you can't overcome this, that your body is somehow flawed and the body can't fix things. It knows how to heal, but you have to do your part in the effort to live that life. So any final thoughts or comments you want to leave the listener with?
No, I just want to remind everyone that at our core, we are spiritual beings and we were created by God, not government.
Mm-hmm.
And I urge everyone, we are under assault, and there are those who want to end our life. We need to turn back to God, and we need to pray that God will guide us through the deeds of the evildoers and help us all stand against them. And that our nation will turn back to God so that we can continue to go forward in all of the positive ways that have over our history made America great. So thank you for having me, Christian.
Thank you very much. Just for anybody who's listening, tell them where they can find your work.
www.truthforhealth.org for the public charity work that I do and all of the resources I've just been talking about. And then my medical website is www.vive, that's VIVE, lifecenter.com.
Fantastic. All right, folks.
And I do still see patients.
Yes. All these years later, you are still in the trenches. And that's why it's such an honor to have you. And I know your time is valuable. So thanks for spending it with me today.
Thank you very much. God bless. Keep up the great work.
All right. Thank you very much. Thanks for listening to Deconstructing Conventional. If this conversation sparked new questions or helped you see things in a new light, feel free to share it with a friend who is on a similar journey. Don't forget to subscribe so you never miss an episode. And a perspective that challenges the norm. Check us out on our website at healingunited.today and find us on social media at Healing United, or you can check out the Healing United PMA app. It's a great way to stay connected. Remember, question everything and rebuild intentionally.